Hello again. Susan's very kindly offered to show us how she uses the Biotherma-Red at home to help manage her pain. Thank you, Susan.
I'm going to demonstrate how I use the Biothermal at home for my bursitis as well as my hamstring injury. I'll lie down on the couch and I'll position the Biothermal over my right hip, as well as pushing in down the back so that it captures the hamstring attachment as well. Do not sit on the product. It has the green button is an on-off switch. Turn the product on, and it's got a heat button. I usually with a up and down arrow to adjust it to the level of heat that you require. I usually do about a 55 degrees Celsius for me, and I will wear some underpants with this product so that I've got a bit of a barrier between the two. Apparently you don't have to, but I prefer to have some kind of clothing on. And I set it it's got a timer, and I like to set it for 30 minutes so I get the maximum benefit from the product.
Thank you. So as Susan said, she likes to wear something in between the product and the skin. So in this position, I don't think it's a bad idea having a pair of underpants on or knickers, whichever is your preference. But it can be used directly on the skin. Remember, it's moist heat that the outer cover produces, and it's the moist heat that gets penetrated through the skin. So if you're looking for good pain management, ideally we'd like some skin exposure for the product to facilitate the infrared heat to penetrate through the skin with the use of the moisture that helps facilitate that process. Now remember, with Sue's couch it'll probably be twice as big. This is just a small one we have in the clinic, but that's a nice safe area that's covering her right hip, that's hitting the ischial tuberosity where the hamstring is attached, and she could also move it up a little bit and get a bit of right lower back issues as well. And that's the same sort of position if you're in a aged care facility or a nursing home. You could have the patient sidelined in this bed with a pillow between the knees. The allied health professional can set the time, can set the temperature. They can then lock that time and temperature in so it can't be tampered with, and you can set the temperature so it's safe. Remember, this product's got inbuilt thermostats, and the issues of signs of overheating or misuse, it shuts down. So it's the ideal product to replace things like hydrocolators, wheat pads, and gel packs. It's a much more advanced form of heat, and moist heat will be the choice of heat for musculoskeletal conditions in the future.